Hola! It's time to wrap up our systemic fungi by going over Paracoccidioides brasiliensis, which causes paracoccidioidomycoses. That's 22 letters of awesomeness, unless of course you have the disease. Like the name suggests, this fungus is distributed in Brazil and other parts of South America, and is even sometimes referred to as the Brazilian blastomycoses. Just saying the name Paracoccidioides makes me think of parrots or pirates, and thus the theme of the drawing is going to be about pirates. But don't worry, it's very different from the pirate scene of chlamydia, and hopefully you won't get them confused. We'll call this drawing Piratas del Sur, Spanish for Pirates of the South, which will help clue you in on the geographical distribution of the illness. And to include this in the drawing, we'll start by drawing a treasure map hanging on the wall that shows South America. Remembering this geographical location is nearly half the battle, because frankly it's one of the most defining features of this fungus. Arguably, the next most important feature, or buzzword, is the appearance of paracoxy in yeast form, which has multiple buds that radiate out from a central vacuole. This pattern is described as looking like a captain's wheel. And we struggled for a while trying to figure out how we're going to represent a captain's wheel in a story about pirates on a ship. And right as we were about to give up altogether, we came up with this, a captain's wheel. So take a look at this captain's wheel and notice how the handles of the wheel are rounded and bulbous shaped. And this is exactly how the yeast form looks like in the lungs. If there's a yeast form, then there must be a mold form. And there is. So that makes this fungi dimorphic, just like all the other systemic mycoses. They take the mold form in the environment and assume the yeast form in the body, mold in the cold, yeast in the heat. We'll draw in our pirate now, and we'll give him this butterfly tattoo. It may not be the manliest tattoo ever, but it is our symbol for dimorphism. Next, we're going to color in the center of the wheel red. This red area approximates the size of a red blood cell in comparison to the paracoxy yeast. So as you can see, this yeast is very large. Recall that the size of the systemic fungi have been increasing with each video. So first was histo, which is the smallest, then blasto, then coxy and paracoxy, which are roughly the same size. Okay, that's enough for the general characteristics. Let's move on to clinical symptoms. As you can see, the captain is coughing, which is a major symptom of the infection, but it's also meant to represent the transmission of the fungus, and that's that it's transmitted through respiratory droplets. Notice we've exaggerated the water droplets shooting out of his mouth. So after you inhale these droplets, the fungus disseminates and causes lymphadenopathy, which can be cervical, axillary, and even inguinal. We'll demonstrate this lymphadenopathy by drawing in these white beads on his dreadlocks. These white beads represent that the disease can affect chains of lymph nodes in the cervical distribution. As the disease progresses, it moves downward to affect the upper respiratory system and the lungs. To demonstrate this progression to the lungs, the pirate has big circular medallions hanging from his necklace, overlying his lungs. These medallions should also remind you of the granulomatous nature of the disease, and these granulomas you should expect to see in the lungs. There is also the development of mucosal ulcers in the upper respiratory tract, especially in the mouth. Often these ulcers will be in the gums of the mouth and have ragged borders with small spots of hemorrhage. They're pretty nasty looking. And we've symbolized this by giving the pirate some pretty poor dentition, with some missing teeth and red spots on his gums. These mucocutaneous lesions and the lymphadenopathy are the most important defining clinical features of the fungus. To wrap up paracoxy, let's talk about treatment. And luckily, it's basically the same treatment as the other systemic fungi. Itraconazole for mild infections and amphotericin for severe ones. So we'll start by throwing in some pine cone air fresheners hanging from the ceiling. Pine cones are for conazoles. And we'll add some frogs, or amphibians, to represent amphotericin. So all in all, paracoxy is pretty simple. And if there's anything you really need to take away from it, it would be the two buzzwords of South America and captain's wheel, as well as remembering the mucocutaneous lesions and the lymphadenopathy. And that's paracoxy.